My name's Emily Headley, and this is our X-ray room. I'm going to put on all of our protective gear. I have our dosimeter right there. And our film. The collimator down or fix it so that it fits the film that we're using by turning the knobs, and then we stick it in the table on our tray. We're going to be doing a right lateral, or right sides down, so we can have a right marker, and then lock it in. Stick it in the X-ray table. Okay, this is Steele. She's the one that's going to be getting the X-rays. She's 46 pounds, so she's an ideal weight and size for the X-ray. She's not too fat. She's nice and trim and muscular. I'm going to use we're going to position her, and then I'll use the calipers to measure her.
Oh, here you go.
I'm going to slide the calipers in right behind her ribs. Just let it rest and not put any pressure down. She measures at a 17. And by my math, with her measuring at a 17, the KVs would be 80 by the Santee's rule. But with our machine that dates back to the 1970s, we figured out that with our technique chart that it works best if we have her set as a 76 for the KVs, and then our MAs is up to 300. That's as high as it goes. So 1/30th and then 300. And then turn the lights off. We'll put her back on her side. Good girl.
Your power's getting low already.
I'll collimate down a little bit, but not to obstruct the image, and then this is when we would take the X-ray.
You put your gloves.
And I have my gloves to put on.
Okay.
This is our processor room. This is where the X-ray would be processed. This is the illuminator where we would view the X-ray. Once the X-ray was taken and we process it, we put it up here. That's where we decide whether we need to adjust the contrast or the density. To adjust the contrast, you would raising the KVs would decrease the contrast. Lowering the KVs is going to increase the contrast. To change the density, we would change the MAs, but not with our machine because it doesn't work that way. Our machine doesn't change. When increasing KVs, you want to multiply it by 15% and divide by the MAs by 2. But like I said, we can't change our MAs. When decreasing the KVs, you want to multiply by 15 and multiply the 15% and multiply the MAs by 2. You can't change that. We do have a technique chart in our hospital. We use it to help the doctor and the technicians to be able to get the correct exposure so that the film is as good as possible, so we don't have to keep exposing the patient to radiation. We also have a log, our radiology log in here, that has our different numbers for each patient, the date, the client's name, first and last, the animal's name, breed, sex, age, weight, the views. We also put in the exposure factors, and there's notes to be used as well to write some extra notes down.